Hi, my name is Faith Olaito. I'm going to be taking you on the course TAU NSC 519 titled Radiology and Radiotherapy in Nursing. Before we start the class, I would like you to understand some things concerning the class. The class involves a lot of assessments, your assignments, some classwork, some tests, and even an examination. I would like you to take it seriously. And as I'll be delivering the slides, please, if you have any question, you are free to reach me on my email, give me a message in the chat box, or send a message to your portal. I'll be willing to answer you. You have to be specific about your questions in the sense that there are a lot of slides and there will be a lot of slides. So in that case, be ready to be specific about the slides, the slide page, the slide title, so that easily I will reference whatever question you have. I wish you all the best, and I'll be sending a lot of course materials. Please be prepared. Thank you very much. These are the learning objectives. These are the course content: introduction to radiology, nursing, structure and components of radiology units, contrast media in radiology, common techniques in radiology, specific nursing procedures, allergic reaction in radiology, activity safety, ethical legal issues in radiology. Introduction to radiology nursing. Radiology nursing is a specialized field of nursing that focuses on providing care to patients undergoing diagnostic imaging procedures and interventional radiology treatments. Radiology nursing ensures patient safety, education before, during, and after the procedure involving radiology techniques. The structure of the radiology unit involves a dedicated space within the hospital clinic where diagnostic imaging and therapeutic radiology procedures are performed. This place has been designed where radiological procedures are performed. The structure of the unit is designed to accommodate varieties of imaging modalities and to ensure the safety and comfort of both patients and healthcare workers. In this unit, there are a lot of hazards, and it has to be noted. Below are the key components and areas found typically in radiology: unit: the reception, patient changing room, imaging room, control room, radiology, interventional radiology room, storage, etc. Contrast media in radiology. Contrast media are substances that are used to enhance the visibility of specific structures of fluid. Contrast means you are creating a distinction between one thing and the other. Example is, if something is white and black, definitely there's a contrast. You'll be able to see what is white and what is black. Improving the contrast between different tissues helps radiologists and healthcare providers to obtain more detailed images and make accurate diagnoses. Contrast media are used to highlight blood vessels, enhance visibility of abnormalities, improve diagnostic accuracy of imaging techniques. And the types of contrast media we have in radiology include iodinated contrast agents, gadolinium-based contrast agents, barium sulfate contrast agents, air and gas contrast agents. Specific roles of the radiology nurse. As a radiology nurse, you must be able to prepare your patients and assess your patients before and after the procedure. You must be able to assist during the procedure. Don't shout at them. Don't look at them and see why is it a big. It's a big deal for them. You're exposing them to rays of energy. Post-procedure care. After the procedure, you must be able to care for them. You must be able to advocate for your patients, and you administer contrast media. You monitor the contrast, the way it's behaving, and then you must be able to ensure the safety of your patient in radiation. Interventional radiation, it can be described as the use of medical imaging techniques to guide doctors as they treat and diagnose certain problems with blood vessels and lymph vessels throughout the body. It's also called image-guided therapy. An interventional radiology nurse specializes in assisting other members of the healthcare team in performing highly advanced procedures. And these procedures involve making small cuts using surgical tools as laparoscopic or robotic surgeries. Diagnostic radiology is a medical specialty that uses various methods to diagnose and monitor diseases or injuries within the body. It provides detailed image of the internal structure of the body, enabling doctors to identify medical conditions early, plan treatments, and monitor the progress. The primary goal of this diagnostic radiology is to produce clear images of the internal anatomy, to detect and diagnose diseases and injuries, to monitor the progression of conditions, and to guide medical procedures. Common techniques in radiology: we have the PET scan, X-ray, CT scan, ultrasound, MRI. These are it's an image showing all techniques. Specific nursing procedures in radiology nursing. You have the enema rectal washout, you have the gastric lavage, you have the IV contrast administration, the patient education and preparation. Sedation in radiology, very important. You don't want to sedate your patients and the patient never wakes up. So it is often, you have to know the importance and how to administer. It's often nice to help patients relax. reduce their anxiety, minimize discomfort during major procedure that may cause anxiety or require stillness for extended periods. We have two types: minimal, moderate. We also have deep sedation and general anesthesia. Also, responsibility in sedation is you must give your patients informed consent. You must give them pre-procedure assessment, and you must monitor the sedation. Don't leave them alone. You must also take care of them after the procedure. Allergic reaction radiology involves nausea. It might be mild, it might be moderate, it might be severe. It might be come in form of vomiting, it might come in form of tachycardia, brachycardia, hypotension, hypertension. It might be severe, laryngeal edema, convulsion. And imagine that. How does it happen? As a result of allergic reaction in radiology, often arising response to contrast media used during imaging, particularly the iodinated one, and certain interventional radiology procedures. Ethical legal issues in radiology. If you are trying to administer radiology procedure, you have to understand the ethical aspect of it so that you are not sued. You are not sued. You must know your boundaries. They are critical in ensuring patient safety, maintaining confidentiality, and obtaining informed consent, and navigating the complexity of diagnostic imaging. In radiology, any part of the body can be exposed. Your patient must know. You must inform your patient. This is what I want to do. Then you must keep the privacy of your patient, and there must be strict confidentiality. You must ensure that they are safe. Your patients are safe from the radiation, and it must be accurate, and the quality of your image has to be good. Don't assume that this is what you have seen, even when you have not seen anything. You must be able to verify your patients. You must be professional about it. You must be culturally competent and equitable in your caregiving. Then you must be involved in telemedicine and remote consultation, because you don't know everything, and you must be ready for research and clinical trials. In conclusion, radiology nurses are integral to ensuring safe, efficient, and compassionate care for patients undergoing diagnostic and interventional radiology procedures. Their blend of technical expertise, patient care, and teamwork ensures that patients receive high-quality care throughout their radiology experience. Thank you for listening. This is just an introductory aspect. I'll be seeing you in the next one.